Let's turn once again to our panel and questions from our younger viewers. Before we get to those prepared questions, Dr. Varma, if I could ask you, we think of parents as the ones that parents and the adults make the health and safety decisions regarding kids, but how important is it to include children and young people in these conversations?
Thank you so much for asking that, because I have two little young ones at home and I'm really trying to include them into the fold because, you know, as a parent, so much we're used to being in the driver's seat. And then it's interesting that you might have a conversation with a partner or a friend and your kids overhear you and they're like, hey, I'm over here. What about me? Do I get a say in the matter? And so I think it's really important to incorporate where they're coming from and have age appropriate conversations. Because if you're talking about somebody who's above the age of 6 or 7, they know what's going on. They're watching television. They're listening to your conversations. They're overhearing and they have an opinion. And we see anxiety in young children and they start to regress if they've achieved certain milestones. For example, if they're toilet trained, they might start bedwetting. So they might have more clingy behavior, more anxious behavior. So as a parent, it's really important to say, hey, what's going on? Tell me about this. Are you feeling more anxious? Are you worried? What are you worried about? Are you worried about me getting sick? Are you worried about you getting sick? Or your teacher's getting sick? Or grandpa getting sick because you might catch something? So I love that question. And thank you for asking, because we don't involve our kids enough and we absolutely need to, because there's a whole idea of parent guilt, you know, mom guilt. We feel it all the time anyway at baseline. And now when, you know, we have to deal with the pandemic and making hard decisions. So include them in the fold and you might feel reassured by it.
Yeah, and we're going to include them right now because we've got some of their questions. I'm going to start with Dr. Torres. This comes from a 7-year-old, Layla, who asks, why do I have to wear a mask if we're 6 feet apart? Doc?
And Lester, I think a lot of us have Layla's exact question. When do I have to wear a mask and when don't I necessarily need to put it on? Now, if you can guarantee that 6-foot distance, then you might not need a mask, but it's really hard to guarantee. And we know the things that actually work to help protect us and other people around us are the 3 W's. Wear a mask, watch your distance, that 6-foot distance, and wash your hands. Those 3 things work. But like I said, if you're out in public, you might not be able to keep that 6-foot distance. And as a matter of fact, a study found also out of Italy that if you do wear a mask, then people are more likely to stay 6 feet away from you because they see that mask on and they know you want to be safe, Lester.
Yeah. Dr. Varma, Terry says, my college sorority wants to open in September and bring in 34 girls to live in a congregate housing facility for room and board. How can they socially distance? What happens if one person tests positive? Would all the girls have to be quarantined for 14 days? What are your thoughts?
Lester, while I definitely respect the role of fraternities and sororities for building community, I do think that 34 is a large number of people to put in one house. I know that a lot of colleges don't want to have even classes, which might only be 1 or 2 hours, not even a full living situation, more than 30 people. So a lot of places are limiting the number of students per Greek house. And they're also saying that rooms should be dedicated for quarantine rooms, whether it be in the house or off campus. And if we want to facilitate community, and if that is the purpose of this, then let's do as much of that community online, remotely, if possible. But I do get that loneliness is a big epidemic in this country, and we want to be careful of that.
All right. Dr. Redletter, Sanjay asks, should we start wearing glasses to protect our eyes from the virus? And my second question is, which is better, goggles or glasses?
So, Lester, also a good question, and theoretically you can catch the virus through your eyes, through the mucous membranes in your eyes, and wearing glasses would probably be okay, and goggles would be most protective, but really we think those types of devices should be reserved for people in very close contact with potential patients, for example, healthcare workers or people working in beauty salons or barber shops where there's a lot of direct contact. We're going to see soon also people working on airplanes and flight crews and so on who are with people all day long in closed spaces. They might be wearing eye protection, and goggles are better than glasses, glasses better than nothing. But I think for the general public, we're not ready to recommend, in fact, that the general public start wearing goggles at this point, Lester.
All right. Well, we're out of time, but we want to thank our panel and all those who participated tonight, helping us understand and cope with one of the biggest challenges this country has ever faced. Closing America's schools as this pandemic took hold some 5 months ago was hard, but reopening them is proving to be much harder. And as we've seen tonight, it's going to take all of us working together to get it right. From Battery Park City in New York, I'm Lester Holt. For all of us at NBC News, thank you for joining us tonight. Good night. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.